Good morning. Thank you for joining us. Welcome to this important conversation panel discussion on Domestic Violence Awareness Month, hosted by the DC Department of Health. I am Shatiria Pearson, your moderator for today's conversation. Joining us today, we have Francina Boykin, who is the program manager for the Child, Adolescent, and School Health Program within DC Health's Family Health Bureau. We have Jennifer L. Porter, who is the director of the Office of Victim Services and Justice Grants. And last but certainly not least, we have Clarence Miles, the executive director of Uniting Our Youth.
Good morning.
Good morning. We're gathered here with a shared commitment to one, raise awareness, foster understanding, and encourage action to combat domestic violence in our community. Throughout this Let's Talk About It, we will explore various aspects of domestic violence, from prevention to support for survivors, and the role that each one of us can play in creating a safer and more compassionate city. Our panelists bring a wealth of knowledge and experience to this table, representing different facets of domestic violence prevention and support. They will provide valuable insights and share their expertise to help us better understand this issue. So let's talk about it. These questions are for Francina. Can you share some statistics or trends related to domestic violence in the DC area, especially in the context of public health?
Absolutely. So domestic violence, also referred to as intimate partner violence, is definitely prevalent in the DC area. It can be divided into four different categories. We have physical violence, sexual violence, we have stalking or psychological aggression. According to the National Coalition Against Domestic Violence, 40% of women and 25% of men in DC have experienced intimate partner violence, a sexual violence or stalking or psychological aggression. Both of these numbers are higher than the national average. In the child and adolescent population, we refer to intimate partner violence as dating violence. And the 2021 National Youth Risk Behavior Survey surveyed a total number of about 7,000 youth in 150 schools. It indicates that at a national level, we have 8.5% of high school students have experienced physical violence, and 9.7% of high school students have experienced sexual violence. In DC, about 11,000 students were surveyed, and at 38 public and charter schools, and 4.7% had experienced sexual violence, and 6.5% has experienced physical violence.
Wow, thank you for that information. Certainly, those numbers, we're working to change that.
Oh, yeah.
So, what are some of the key services and resources that the DC Department of Health, Community Health Administration offers to individuals affected by domestic violence?
Sure. So currently, DC Health is an awardee of our CDC. CDC is the funders of some of our programming. It falls underneath the Rape Prevention and Education Grant. And the overarching goal is to prevent sexual violence and sexual violence perpetration and victimization. And we also have a service underneath our Preventative Services Health Block Grant. And it helps support the Sexual Nurse Examiners Program, which we refer to as the SANE program. It is a specialized healthcare service that provides comprehensive health services in a hospital setting to survivors of sexual assault. The nurses receive specialized training, and they work closely with law enforcement and other agencies to provide quality care to those who have been affected.
Wow. So with those trends that you stated happened here in DC, and obviously we're working towards lowering those numbers, how does DC Health's Community Health Administration collaborate with other organizations and agencies to address domestic violence in this community?
Yeah, so with our first programming through the RPE program, we partnership with DC Coalition Against Domestic Violence to have a sexual violence community of practice. So this is an opportunity for professionals across the district to get together. We receive some training, we talk about what's going on, and receive support from professionals so that they can take it into their lines of work. We're also currently partnering with an organization called Beta Omega Social Services. They we refer to them as BOSS, and they operate out of 5 DC public schools right now. And they have group sessions where they utilize a curriculum called Expect Respect. And so, additionally, we have partnered with DCPS at one point and provided training to 26 mental health professionals so that they can also expand the reach of Expect Respect programming. And we are coming up on another grant cycle, and we're looking forward to expanding even those efforts further. We're excited about that. And also, as I mentioned earlier, the same program, DC Health collaborates with the DC Forensic Nurse Examiners to provide the patient-centered forensic care to victims. And to date, 100% of district hospitals have undergone this training as to how to care for victims of sexual assault. So that's awesome to have that support at the hospital level.
Thank you.
Mhm.
Thank you for highlighting agencies and organizations that are partnering with you all to combat this issue.
Mhm.
Could you talk more about the specific initiatives or programs aimed at preventing domestic violence and promoting healthy relationships in the DC community?
Sure can. So, in addition to the ones that I've mentioned previously, we do also partner with Young Women's Project to run our Youth Advisory Council, in which the youth are learning how to be peer educators in the areas of sexual health and mental health. And a part of that is a healthy relationship course. And so they become, peer educators amongst their schools and leaders. And we're excited. We just started a new cohort. And we had a meeting recently, and it's about 30 youth are part of that group. We also have partnerships with Crittenden Services of Greater Washington. They provide healthy relationship training and curriculum to groups of young men and women. And then we also partner with Healthy Babies, who provide some group sessions on healthy relationships as well.
Thank you.
Mm-hmm.
Thank you for highlighting all the work that you're doing here at DC Health and for the DC community.
Yes. Can I highlight one more thing? I'm
Absolutely.
sorry. I just want to also put a plug in for both the DC Coalition Against Domestic Violence and the DC Coalition to End Sexual Violence, both of which are nationally recognized coalitions here in the city, and they offer a ton of resources on their website as well.
Thank you again.
You're welcome.
Next, Clarence, can you
Yes.
tell us more about the organization you founded, Uniting Our Youth, and its mission?
Oh, well, our mission is to save one kid at a time and unite kids from all over the city. My organization is United Our Youth. We are all spring from another organization that was working with over 12 years called Alliance of Concerned Men. I have to always mention that because with them, they gave me the training and the leadership skills to me to develop my own organization, working with the youth around the metropolitan area.
Okay, thank you for that background. What are some common misconceptions or stereotypes related to domestic violence and masculinity? And how does your organization address this?
Well, it's personal with me because I was also was in a domestic violence myself as a young youth. I was dealing with an older lady, and like my father said, she had my nose wide open, and she controlled me for many years, and one of the short long stories is that after we got finished out in the street and ran about, I wasn't able to go out and live a normal team life because I got involved at an early age. I was like more controlled. I can't go here. You couldn't do this. You're not able to do that or this. Your friend. When that time would come, we talking about we have friends and stuff. You can't be with your friends, your buddy that you grew up with. And one day she smacked me, and I was like stung and I was shocked and I didn't know how to deal with it. And then she smacked me in front of one of my friends, and I wore it for a long time. So in other words, is that today I probably would never have got into a relationship because what I understood is that people tell me that she was much too old for me at the time, and probably she probably went to jail because she was 18 years older than me, and I was 16 years old. So if I was 16 years, she was 18. So that means, and I couldn't accept it that what they were saying was a place that I shouldn't have been. But if I look back into it yesterday, I thank God for the experience in the relationship. But also after she smacked me some weeks or months later, um, I was a victim of retaliation, all because I didn't know how to deal with the response that I got the first time. And I ended up smacking her up in Giant State up in New Jersey. She went down and she went into like almost like a seizure. And I asked the Lord to help me
Mm.
because I couldn't explain to nobody why I hit this woman. And it was all because of what she had done to me some months earlier. So the good Lord blessed me. I was able to make it through. And today I know not to put my hand on anyone else, but I did have another experience in another way because when you're being attacked by females, sometimes you feel like your manhood is in jeopardy. If you're not old enough to understand that sometimes you don't have to respond to everything, then you learn a lesson. Some of us, I'm fortunate that I wasn't able to be incarcerated, but I was able to call the police during that incident when this young lady that I was living with, and he was able to come past, and I was allowed her to move her stuff out the house, and I was able to remove myself from that after I've grown up from these domestic violence, because men can be in domestic violence just as well as females.
Absolutely.
Yes.
Thank you for your personal story and how it fueled your passion
Mhm.
for the work that you do now.
Yes.
So thank you for that personal
Mhm.
context. What have you learned from your own domestic violence experience that you just told us about? And what would you tell young men today?
Well, today I can tell young men from my experience that at my organization we also have classes about domestic violence. We have people that comes and talk to our youth about domestic violence. We also let men know that they don't have to prove their manhood just to make themselves feel whole. And a lot of times we have to learn how to step away from a situation. Also, we have to be man enough to ask for some assistance. A lot of times we don't want to ask for assistance because we think that we can handle it. Today, I found out that men are getting more help with domestic violence than the females are because we understand one thing is that a lot of time we end up incarcerated trying to prove a situation that don't need to be proven. So, and with that, I ask kids, to get help, seek help, call other organizations and stuff like that. I work closely with a lot of domestic violence people who have groups and training programs. One is like Queen Latifah. I have a young lady I spoke to earlier. She have a program with domestic violence and people like that.
Thank you. You highlighted some organizations that you're currently partnering with to combat this issue in DC. But what other community based organizations like yours that
Mhm.
you work collaboratively with um, and government agencies to create a more comprehensive approach?
Well, I also work with the Department of Health, also
Okay.
myself. I also work with the Alliance of Concerned Men, who also have programs like that. Again, one time that we still, most of my work is in the housing authority, so I work closely with the DC Housing Authority to combat, the domestic violence that's within the communities of the communities that we serve.
Perfect. Thank you for your leadership in DC, especially as it pertains to men and domestic violence and spotlighting that because we don't
Mhm.
often hear about that. So thank you again.
Thank you so much.
Next, but certainly not least, Director Porter. Can you explain the role of the Office of Victim Services and Justice Grants in supporting victims of domestic violence?
Sure. And thank you so much for having me. Our role is to develop, but mainly to fund programs, initiatives that essentially maintain and build the system of care for violent survivors, their young people, and their families. And we do that in a couple of ways. I'm really proud that our city, under Mayor Bowser's leadership, has made significant investments and support from housing, emergency housing, trauma informed mental health, um, counseling, advocacy, outreach, and much more. We do that um, through amazing community based organizations, like one that we heard about today, but many organizations that we work with, including the DC Coalition Against Domestic Violence, to educate our community, but also to provide those critical life saving services once our neighbors have been victimized. In fiscal year 2023, we provided over $19 million to support domestic violence services, including housing, as well as domestic violence mental health services. So, as a grant funder, we allow our community based organizations to apply for funding. to get creative, to use their life experience, but also their subject matter expertise to develop critical programs to be able to not just support survivors and their families, but also to help us in partnership to build up the continuum of care.
Thank you. Thank you for the work that you're doing at the Office of Victim Services and Justice Grants and highlighting how your financial support is benefiting the residents of DC. What resources and services are available through your office for survivors of domestic violence?
Sure. Our office, as I mentioned, as a funder, we fund amazing community services, but we also fund some really critical programs that support survivors. One of the programs is the Address Confidentiality Program, also known as ACP. It's a program where survivors of domestic violence, stalking, and abuse can actually protect their address from district records or public records by applying to the program, qualifying, and being a part of it. It's an opportunity to support survivors after they are relocating from violent situations for their safety. We're really proud to administer this program. It continues to grow, but it's also a really important resource that our office actually administers.
Wow. We know that supporting victims and survivors of domestic violence is not an easy task. So, what are some of the most pressing challenges in your experience in providing adequate support and justice to survivors of domestic violence? And how is your office addressing these challenges?
Sure. I think this is such a great question because in the context of so much that other sister agencies in our public safety and justice cluster are working on. Our work, particularly in the domestic violence space, some of the issues are honestly exacerbated by the pandemic. Mm-hmm. So concerns and issues like isolation, providing services, turnaround, staff turnover, at serving agencies and community-based organizations is exacerbated in our space, and particularly for services that need to maintain confidentiality and to be able to negotiate safety. And so we've been working hard. I think, I'm really proud of the investments that, this administration has made and continues to make. We have funded a total of 295 units in FY 2023 for domestic violence support. Awesome. And we're proud of that because for a lot of survivors being able to negotiate their safety and safety plans, one of the critical issues is housing, right? And so we know across the district, there are investments being made to improve housing, but we know we're standing in the gap to make sure that there's housing available for survivors. We're really proud that one of our investments made through the American Rescue, support from the American Rescue Plan, we opened DC Safe opened a new safe crisis shelter. And with that opening, DC now has a 24/7 domestic violence crisis shelter. The organization DC Safe has for years done phenomenal work, and we're so proud that they are championing this investment, among others. And so some of the challenges with housing, as well as the challenges with, just isolation and needing access to services, virtual services, we're continuing to make those investments. But honestly, I want to elevate that the community, our community-based organizations have really rise to meet and to make that investments. They continue to innovate in their offerings, and really proud of that. As we meet the challenge, we're having the community to support us in meeting that.
Thank you. Thank you for highlighting the challenges that we have experienced during the pandemic, and we're still having some of those same challenges. The pandemic isn't technically over, so thank you for highlighting that. Are there any specific initiatives or programs that your office has been involved in to address domestic violence at the systemic level?
Sure. The initiative that comes to mind is our DC Domestic Violence Fatality Review Board. Our office provides administrative support, and is the lead agency that supports that board and the critical and solemn work that the board does. Every month, the board convenes with members of the public, member representatives from various DC government agencies, as well as federal agencies that are really a part of our public safety system, as well as members who are a part of our safety continuum of care. We review domestic violence fatalities, as is apparent in the name, but we work to identify what has happened through the case review, uh, and how our neighbors and residents died, but to understand more how they lived and what their experience was. And we lift recommendations to city agencies, but also policy and systemic level recommendations to change, so that we can work in partnership with DC Health and our other grantees who are working on the prevention side to identify those upstream gaps, to be able to learn from, the unfortunate situation and lived experiences of those who have died, but to make sure that we're taking that information to inform system level changes that can make our city better, and that can make our systems work better for survivors.
Thank you. I want to say thank you all for your level of expertise that you all have provided today. Thank you, Clarence, for your personal experience that you've shared so graciously with us today, and how it's fueled your passion in the community. We've come to the end of our panel discussion, and I hope that you found this conversation enlightening and thought-provoking, especially with all of the statistics and the trends, and the work that we're doing, the work that we need to do. Our panelists have shared invaluable insights and information, and again, I want to thank you all for your level of expertise and your dedication to DC.
Thank you.
Remember, this discussion is just the beginning. Domestic violence awareness and prevention require ongoing efforts from all of us. Let's take the knowledge and inspiration that we've gained today and turn it into action in our communities, and collaborate with other community organizations. If you or someone you know is in need of support related to domestic violence, call the DC Victim Hotline for guidance and support. If you need that number, it's 844-443-5732 or 844-4HELP-DC. Your safety and well-being are important to all of us. Thank you for joining, and stay tuned for DC Health's next Let's Talk About It.
Thank you.
Yes.
Bye.
Bye.